In the last section, we're going to talk about the barrier and limitation of neuraxial ultrasound. First thing we'll talk about is thoracic epidural. Um, as you already know, the angle of the spinous process in the thoracic region is a lot more acute than the lumbar region. So for that reason, if you're trying to obtain the transverse interspinous view, it's going to be very challenging, if not almost impossible. You can still see something in the parasagittal oblique, but the posterior complex is a lot more difficult. It's still more difficult to visualize in the parasagittal oblique. So overall, the ultrasound of the thoracic region is just more challenging, a lot more challenging than the lumbar region. Um, and then you probably wonder if we can do neuraxial anesthesia under real-time ultrasound, and the answer is yes, but it's not widely available. It is technically challenging. If you think about it, you have to try to obtain the image, visualize your needle, and then if you do epidural, then paying attention to your loss of resistance as well. If any of you do peripheral nerve block, um, like even just obtain image and keep your needle in view. Just do two tasks by themselves already challenging enough. Now you add another task of paying attention to a lot of resistance. Um, so this device right here is called an EpiGuide. It has a channel for the needle. So in the past, with the real-time ultrasound, often required two people. Uh, just because we have one hand to hold the ultrasound transducer, one hand to hold the needle, and then you also need the syringe for the loss resistance. But with this device, it has a channel for the needle, so you can do it by yourself without assistance of a second person. But it is not widely available. I do think this area is pretty fascinating, and I hope we'll see more refinement and new technology coming out of this technique. But for now, it's not widely available. Lastly, I think it can be it can be a steep learning curve at the beginning to learn the sonal anatomy of the lumbar region. And we talk about in the second part of the video, it can be the sonal anatomy can be confusing. It may take a while to get used to and recognize these patterns. So I think it can be discouraging for some of us at the beginning to go through this initial learning curve before we notice any potential benefit of this technology. That's why I think we should scan as often as possible at the beginning, specifically starting with like easy patient, gain some level of competency, so that way we can, when we encounter difficult patient, we can carry it out in a proficient way. So in summary, I think doing the ultrasound scan before performing spinal epidural is still a good thing to do. Ultrasound is a valuable tool for neuroaxial anesthesia. It has not revolutionized the way we do spinal epidural the same way the same way it does to peripheral nerve block, but I still think it has a lot of benefit. Um, like I say, the real-time ultrasound is not widely available, and until more exciting technology coming out, um, I think this is the best that we have at the current moment. And ultrasound is widely available at most institutions. So with some learning and with some practice to learn the sonal anatomy, I think this can add a lot of benefit to your clinical practice. Um, so yeah, that's the end of the presentation. I hope you find the presentation informative, and I hope it's helped you find it useful in your clinical practice. Thank you.